Dr. Vidhya Krishnamurthy at Loma Linda University Children's Hospital discusses the diagnosis of autism.
Autism really is a very complex neurodevelopmental disorder. It's associated with difficulties in social interaction and communication, as well as behavioral symptoms such as repetitive motor movements and repetitive speech, as well as fixated interests. It's a fairly common diagnosis. It impacts about 1 in 88 individuals, according to the most recent prevalence data. And really the symptoms you're looking at with autism are along those two spectrums, which is the social communication deficits, which include things like lack of eye contact or poor modulation of eye contact, a limited range of facial expressions, lack of use of gestures when you're communicating or talking, lack of interest in peers, difficulty developing friendships, difficulty engaging in a back and forth interchange or conversation, difficulty empathizing or engaging in any kind of make-believe or pretend play. And then you've got the second set of symptoms, of course, which is the behavioral issues, such as the stereotyped or repetitive speech, the motor mannerisms, the difficulty adjusting to any kind of changes or transitions, as well as sensory sensitivities and kind of a fixated interest.
What are the treatments for autism?
But really common treatments that are recommended to address autism symptoms are speech and language therapy services, really focusing on addressing any language delays noted, but also the social pragmatic communication skills that a lot of the children with autism lack. Occupational therapy services to deal with sensory sensitivities, as well as a range of psychotherapeutic services. But a lot of research is now looking at parent-child interaction models as well, things like floor time or relation development intervention or PCIT as a way of using the parent-child relationship and the back and forth interaction between the parent and child to kind of foster some of these skills. So really it's dependent on what the child needs. I had an 11-year-old Latina patient a few years ago who came in already with the diagnosis of an intellectual disability. And there were concerns really about autism based on the symptoms mom and the teacher were reporting, such as really no awareness of other children in the classroom, no interaction with others, and really unusual use and play with toys. In terms that there was really no functional play noticed. The one positive thing we really did notice was that there was a very strong connection with mom. Throughout intervention, and throughout the testing process and the intervention, there was a lot of repetitive speech, but it would be repetitive speech towards mom. She said, "I did a great job, mommy." She said, "I did really well, mommy." So what we decided really to do in terms of intervention and use that connection between him and mom in terms of trying to foster some of these skills that we wanted him to show. So we were able to use some really positive skills in terms of his relationship with this mom to foster development in other areas. If any of those symptoms sound familiar to you, I think the first step is to talk to your pediatrician about your concerns, really having that discussion or conversation with your pediatrician about what you're concerned about, why it's concerning to you, and where you would like to move next.